All right, hi everybody. I'm here with Tara today, and we're going to do sculpting of the ankle area, which we often call Cankles, right?
Yes.
Just a little compilation of calf and ankle area. So this is an area that very few doctors do, and it's because it's a very intricate area. We have to go all the way around the leg in a circumferential manner. And how are you doing today?
I'm good. Good. Excited.
You're excited?
Very excited.
Okay.
Yeah.
Are you a little anxious too?
A little bit, but I think that's normal,
Okay.
right? Yeah.
Yeah, it's a little normal for everybody.
Yeah.
So do you mind telling me what you do?
I am an ICU nurse.
Okay, so we have a lot of nurses, a lot of doctors,
Yes.
all different professions that come in here. So you're obviously very thin, okay?
Yes.
And I know you have to follow a great diet, right?
I do. I eat very, very well. I exercise 5 days a week, personal train.
Mm-hmm. Okay.
Nothing gets rid of them.
Okay, so in a second we'll take a look at Tara's ankle area, but as you can see, she's very, very thin, and the problem is that, you know, no matter what you do, I mean, you can't get any thinner, right?
Thank you.
You can't lose any more weight and, you know, still be healthy, right?
No, you're very right. Yeah.
So the thing about ankles and calf areas, when people accumulate fat there, it's usually because of a genetic issue. It's not because they're overweight in general. You know, a lot of our patients are very thin, just like Tara. So have you tried doing exercises or other things to thin out your ankles?
Absolutely. I have Googled everything on the internet that it says to do to try and thin them out. My mom has jokes, and I was very young that I have her legs, and I do.
So one thing I'll address here is that usually exercise does not make things smaller because the fat around it has to be burnt off, okay? And when you exercise an area, you're not burning fat from the area, you're burning fat from the entire body. So most of these you know, routines that you see on the internet, how to get skinny ankles or skinny anything, is not going to do anything except build the muscle in the areas that you're doing the exercise in. So how about we take a look here, and I'm going to show our audience. So I'm just going to back up here and show you a little bit of Tara's legs, and we can see right here as I zoom in on the ankle area. Can you just like slowly do some of those, a 45-degree turn for us? Okay, and then can you go up on your tippy toes? Okay, and then come back down, and then kind of turn that diagonal facing the wall right there. Okay, and then go up on tippy toes. Great, and then face the wall now. Okay, and then go up on tippy toes. Okay, and stay right there. I'm just going to back up here. I'm showing our audience, you know, basically how, you know, your perfect skinny waist and everything, your thighs are very thin, and then down at the bottom, you know, that's where you have some excess fat. So you can turn back around now. One of the things that I find is that a lot of patients who come in here have been to other consultations with plastic surgeons of different sorts of people who also do liposuction. Had you looked into this before?
Yes, I have. 2 doctors actually told me that they couldn't do it.
Okay.
That I wouldn't even really see any reduction in anything in their practice.
Can I prove them wrong today?
Absolutely.
Okay.
Please do.
So, regardless of what you hear, I hear this all the time from patients that come in from all over the world to do ankle surgery. Doctors that don't have much experience doing this will usually say, it's your muscle, you don't have any fat there, or it's swollen, it's fluid, or whatever. Or it can't be done, or it's unsafe to be done. So all these things are propagated out there. There's only a small number of doctors that do this because you really have to be specialized and have a lot of experience doing liposuction because it is an intricate area. And we're going to prove today that you're going to have skinny ankles, and you're going to see them immediately, and your skin's going to be tight. There's not going to be any issues with your skin at all.
Awesome.
Okay, you ready?
I am ready.
Okay, awesome.
Go.
Thank you. Hey, Tara.
Hi.
How are you doing?
Oh, this is amazing.
Okay, so I am zooming in on the new ankles. You want to just roll your legs a little bit to one side? Yeah, okay, that's beautiful. And turn back a little bit. Okay, I'm just going to come over here. I'm going to do the same thing again. Roll it a little bit. Okay, back. Awesome. Okay, Tara, go ahead and stand up. This is Tara's first chance to see everything.
Wow. Oh, this is amazing.
Okay.
Let me turn.
Yeah, you can face the mirror and just take a look. I'm filming in the mirror right now.
Okay.
And
Oh my gosh.
you get to take a look from every angle. Just
That's so.
appreciate ankles that you've never had before.
I've never had this before.
Okay, why don't you go on tippy toes? Take a look at what you look like in high heels. Look at that.
Wow. That's amazing. Yep.
Okay. Okay, cool. All right. How was it so far?
It's been good. It's
Okay.
been good. The needle, the lidocaine was the only stingy part.
Okay.
Otherwise, not bad.
Great.